and it's really accurate, because the doctor is going to insert an instrument through your vagina, and then they will have a proper view of the cells. So what are the signs and symptoms for cancer? Well, we have cervical cancer. So here we have the signs and symptoms. As we said, an advanced cancer which is not advanced, shows certain symptoms, and there is also the symptoms specifically for the cancer which is advanced. So we are going to mention them together. So one of the most important signs and symptoms for cancer, guess what it is? Well, it's vaginal bleeding. Vaginal bleeding is one of the signs and symptoms for cancer, and it's the first one which is going to be on our list. Now, vaginal bleeding, of course, is very important in women, because it's the only way through which they get rid of the unfertilized materials from the uterus to the outside world. But vaginal bleeding can be worse than normal, of course, or it can tend to occur at the time that the woman is not supposed to be having vaginal bleeding. Guess what I'm talking about? The menopause. Women in their menopause are not supposed to have any vaginal bleeding. And the other thing is, women, after having sexual intercourse, they are not supposed to have vaginal bleeding. Or, for example, in their periods, when the bleedings become more than usual, it is abnormal to have such things. And as such, why can't we just do the pap examination, the pap, so that we can have a proper view of their cervical cells, and we see if they are proliferating or not. We detect viruses such as the HPV, the one which is prone to causing cancer in most women. So women are not supposed to have severe bleeding in their menses, and also women are not supposed to have bleeding in their menopause or after sexual intercourse, and as such we are going to suspect cervical cancer. The second thing is heavy bleeding, no sorry. Heavy bleeding is linked to vaginal bleeding. Women are not supposed to have heavy bleeding during their menses. And as such, we are going to suspect the presence of the HPV, the causative organism for cancer. And as such, we are going to also suspect cancer of the cervix. So women are not supposed to have heavy menses. That's good, right? So the third thing is lower abdominal pain. And the reason why there is lower abdominal pain is because there is these tumors growing. The cancer can move, can spread. And as we described cancer is an abnormal growth, an abnormal increase in the number of cells, and that can cause pain in the lower abdominal pain because they are growing abnormally. So lower abdominal pain, of course, is going to be there. there's going to be pain in the lower abdomen, and then the growth of cells is going to cause the pain because it's growing abnormally. And the fourth thing I would like to talk about is leaking. For example, leaking of urine. Really, urine is not supposed to pass through the vagina. Or fecal matters, they are not supposed to pass through the vagina. But because of the fistula which may form, because the cancer can metastasize, can move, it can spread in the lower abdomen, from the cervix to other parts of the lower abdomen, and then it might go across the bladder, and then it can cause what we call a fistula. And in this case, the connection between the bladder and the vagina, it's what we call the vesical vagina fistula. Or of course, it can go to the urethras in women. And the connection between the urethra and the vagina is what we call the vaginal fistula. It's a fistula. And what a fistula is an abnormal wall, a connection between two cavities. And that can cause the contents in the bladder. For example, if it's a vesical vagina fistula, it can cause the urine to come from the bladder and go into the vagina and starts coming out. Even the fecal matters might pass through the vagina. So that is one of the signs and symptoms for cervical cancer. It's number 4, it's leaking. Leaking, for example, e.g. urine. Urine coming from the urethra or from the bladder and into the vagina and comes outside. Urine through the vagina. Vagina opening, of course. And the other thing is that women, they are going to complain of pain. Back pain, of course there's going to be pain because there's an abnormal growth. So this is going to cause women to start complaining of pain, back pain. Because as we say, the cancer is an abnormal growth, and as it's growing, the tissues are also growing. And as it's growing abnormally, of course it's going to cause discomfort, and that can cause pain. Really, it's something that is really painful because of an abnormal growth. So there's going to be back pain. The other thing is anorexia. And how is anorexia comes about? This is quite interesting. Anorexia is lack of appetite. And how is it coming about? Well, I'll have to write this and then I'll have to explain. Of course, anorexia is lack of appetite. And it's one of the signs and symptoms for cervical cancer. And the reason why there is anorexia, is because the human papillomavirus, the HPV, produces proteins called the cytokines. And it's these cytokines that are going to cause anorexia. They are coming from the human papillomavirus and circulate in the body. The human papillomavirus introduces the cytokines, and these cytokines are the ones which are going to cause anorexia. And having anorexia, saying loss of appetite, since you are not eating, then the next thing that you are going to become is you are going to become less fatty. you are going to be losing weight. So the next thing that you are going to become is thin. You are going to slim, of course. Yeah, you are going to slim. So one of the signs and symptoms again for uh, cervical cancer is loss of weight. And that's our number 7. And the loss of weight is coming in about as a result of anorexia. And anorexia is coming from the cytokines which are being produced by the HPV, which is present in the blood, and then causes anorexia. And anorexia is going to cause the body to start utilizing, to start finding other means. Since there is no body, there is no food, you are not eating, so the body will find other means of feeding itself. So it will go into the muscles, it will go into the adipose tissues, and then it will start making those fats and turn them into energy as their energy source. And as a result, you are going to lose weight. So one of the signs and symptoms, classic signs and symptoms for our cervical cancer in women, these are the ones that we are going to look out for when we are diagnosing cervical cancer. Number 1, smoking. Number 1, vaginal bleeding, heavy menses, lower abdominal pain, leaking, e.g. urine from the bladder and into the vagina, or the fecal matters from the large intestines and into the vagina. Back pain is going to be back pain because the cancer is growing. It's going to be anorexia because the cytokines released by the HPV are going to cause anorexia. And then there's going to be loss of weight because of anorexia. The next thing we want to talk about is the stages of cancer. And afterwards, we're going to talk about how we can manage and treat it in our clinical area.